The purpose of this video is to help you understand the enteral connection. In this video, you will learn what ENFit is and why we use it, how the ENFit connection works, how to clean your ENFit connection, how to administer medication into an ENFit feeding tube, and a few important safety tips. ENFit is a standardized feeding connection for all enteral feeding tubes. It is a safe connection that will only allow entry of items that are meant for feeding tubes. The worldwide initiative to use ENFit has improved patient safety. ENFit prevents accidental connections between feeding tubes and other types of tubes, such as IV, that could cause patient harm. For example, we want to be sure that a patient does not accidentally receive enteral formula into an IV line or an IV medication into a feeding tube. The new connection is a secure twist-to-lock connection between the feeding tube and the syringes or feeding bags you are connecting to. Most ENFit products will be purple, so you can be sure you're using the right one. It will only connect with other feeding tube items. Many patients across the country use ENFit and are very pleased by the tight, secure connection and its ability to prevent leaks. Conveniently, the brand of feeding tube and supplies will not need to match in order to ensure a secure, safe connection. It is important to keep the feeding tube clean from buildup and residue. You'll need to clean your ENFit connection daily. Doing this is easy. You will need a syringe of clean, warm water, a clean, hard bristled toothbrush, and a clean piece of cloth or gauze. Begin by washing your hands with soap and water. Then, fill the syringe with warm water. Plug the hole of the feeding tube port with the bristles of your cleaning brush and forcefully flush the moat, which is the open space around the center opening, with water. Rotate the brush inside the moat to clean. Also, use the syringe to clean the cap of the feeding tube, using bristles to break up anything in the cap if needed. Then wipe the tube port and cap with clean gauze or cloth. Allow all pieces to air dry. You can repeat steps 3 through 6 if more cleaning is needed. Giving medications in an ENFit feeding tube will be slightly different than other connections. To begin, we will need to fill the syringe with medication. We will utilize a special medication straw in order to prevent the moat of the syringe from filling and wasting medicine. First, connect the ENFit medication straw to the ENFit syringe. Second, insert the straw into the bottle of medicine. If the straw is not long enough, you can also pour some into a medication cup and insert the straw into the cup. Third, pull up on the syringe plunger and then push it back down to help eliminate air bubbles. Then drop the desired medication dose. Disconnect the straw from the syringe and gently tap to remove any remaining medication. If bubbles are present, carefully tap or flick the syringe to remove the bubbles. Attach an ENFit syringe filled with water and flush the feeding tube or extension set. Then detach this syringe. Next, attach the ENFit medication syringe to the feeding tube. Once secure, gently push the plunger to transfer the medication into the tube. Detach the syringe and flush the feeding tube once more with water. Once you have administered the medication into the feeding tube, you will need to clean out the medication straw to ensure that no medicine is wasted. Take the empty medication syringe and pull back on the plunger to fill it with air. Screw the air-filled medication syringe back onto the medication straw with straw tip in the bottle. Push the plunger all the way down to allow the air to force any remaining medication back into the bottle. If you use a medication cup, also pour any remaining medication in the cup back into the bottle. Important ENFit safety tips. If possible, try to refrain from drawing up medication into a syringe without using the straw. This is because excess medication can sit in the moat of the syringe tip and give a larger dose than desired of medication to the patient. Using the medication straw will prevent any medicine from getting into the moat area. It is possible that a patient may need to be seen at a facility that does not have access to the ENFit products. For this reason, we highly recommend that all feeding tube patients take an extra ENFit syringe or two with them should they need to be seen at a facility outside of the IU Health system. For more information and written instructions, please visit us online at iuhealth.org/enteralnutrition.